Hi everyone, welcome to another review of the D-Life Diploma, the world's largest, grandest course in metabolic health and disease reversal. So today I have with me Dr. Shashi Thakur. She's an Ayurvedic doctor, has been in clinical practice for more than a decade, and she has worked extensively in different geographical areas in Maharashtra. Has a very excellent practice and has done a lot of very socially relevant work. And I'm very happy to have her in this review. Welcome, Dr. Shashi.
Thank you. Thank you so much.
Great. So let's start with some of your background quickly. You are, of course, an Ayurvedic doctor. You have practiced with real patients for more than a decade. So can you please share a bit of your journey, before you joined D-Life? So what you were mainly handling and then what attracted you to this field of metabolic health?
Okay. I was handling the cases of chronic disease like constipation, acidity, and joint pain like rheumatic arthritis, osteoarthritis, many types of diseases, chronic. So in that, I also advise the diet also with medicine. But in 2021, I got detected with the cancer, breast cancer. So that time I was very devastated and I was in so pain. After that, my aim was that to find the nutrition course and to do from the main best institute. So I was in the search of the nutrition course. I have taken the brochures of the Symbiosis, VLCC, and other institute also, but I was not satisfied with their what articles or sections or sorry chapters. I was not satisfied, uh, but I was in search of that. 1 year before, I have watched your video so on metabolic health. So I got so impressed with you, with your knowledge, and due to our friend, the common friend Prashant Kulkarni, got connected with you, and we had a talk on that. And after that, I have joined the D Life. So in my practice, I was doing the best with the diet. Then also I got detected with the cancer. So main issue was that. So I want to work on my nutrition, on my diet. So I have joined the D Life. And for
Great, great.
patient also, my family also.
Absolutely, absolutely. And we learn nutrition definitely, and we also learn the real big picture of all of these chronic diseases, correct? So the work that we have picked up to do of disease reversal, so that is real, cornerstone of this thought.
Yes.
Uh, so now that you have completed the course, so I want to sort of come to the course itself, right? So which are the things that have, really impressed you the most about this, that you have loved about it and enjoyed the most?
The course is a plethora of knowledge. Every section about nutrition, about biochemistry, physiology was well explained. And it's like a ocean only. जितना आप उसमें डूबोगे उतना आपको मिलेगा. It's like that only. So I was enjoyed a lot, and videos are the topping on that. They are very informative and practical, well practically researched and said about the everything, every diseases. So, and main thing was that when I was doing the course, we have the WhatsApp group also. So on WhatsApp group, we got to know daily new data, new researches, new evidences about the diseases, case studies also. And one thing I want to say that in our Ayurveda, uh, I mean, D life is not a fad. It's not a fad diet. It's its root is from the Ayurveda only, because in rheumatic arthritis there is a diet in our book also. Our ancient Vedya also said that avoid the dairy products. You know, avoid the dairy products, fish, and in our protocol also there is to adopt the carnivore diet. So there is a connection between the Ayurveda and the D life protocol. So that's why I get so much impressed and go into that. So I like that.
So you found some interesting commonalities there.
Yeah, it is
Got it,
there.
got it.
And in our diet now, they also advise the non-vegetarian diet also. It's not like that ki Ayurveda doesn't allow the only
Absolutely.
vegetarian diet.
Yeah. A lot of people have that misconception, but I
Yes.
think because of Delife's work and also especially Ira's posts,
Wagbird, Charak,
yeah,
all of them are advised.
absolutely, absolutely. Unfortunately, a lot of times what happens is that people don't open up their own books and read. So I was also very curious. So I also opened up Charaka Samhita and seen that Charaka has explained the use of meat and eggs in much detail. And now we are able to use that as one of the protocols. Of course, not everybody
Yeah.
needs to be on carnivore protocol, but we have definitely used that. And there are coaches like Ira who have used it in reversing very tricky conditions like autoimmune. Correct? Good, good. So also you went through this course over a period of months, right? And while somebody is going through a course, whether they have medical background or not, they still need a lot of support. So how did you find the overall support available and the resources for a student?
Yeah, access to the forum is very nice because on forum there are so many 2000 plus recipes uh, of vegetarian also, non-vegetarian also. So I like for that. And there is a 24 by 7 WhatsApp group support for us and hand holding cases. They do hand holding also. So I think, I don't think so. Okay, this type of support I could have get from the other institute. So it is very nice, and it is the course is the online course. So I could have completed this. Otherwise, I don't think so. Okay, I would have made it.
Correct, correct.
Very nice.
Right,
Mentors are
right.
very helpful. They don't even wait for the others to give the answers. The one who is see the message, they give the answer only.
Yes, yes, definitely. Yeah, we love to interact with all the teammates at D Life, and it's all a part of teamwork, right? We are picked up to do a big, really big work in this area. So it's going to happen only when all of us join hands. And as Ira also likes to say, we are, with the forum and the WhatsApp group, we are like in a classroom 24/7. So while we don't necessarily do lectures in that sense, we do podcasts and conferences. But the support is available. Somebody in D Life family is up at any time of the day and night. We are also spread across 21 countries now, right? And more than 330 of us. So definitely, I see the new energy because of all of you joining. And I mean, since I joined 2 years back, there has been a tremendous growth at D Life. So it is heartening to see that you got all the support that you needed. And one important point is that this is an anytime, anywhere course. It's a remote course, online, self-paced. And in this new era of skill building, that is how the courses should be designed. Because the older model of classroom, we can't really reach everybody, and we wouldn't have reached 21 countries for sure by sticking to the old model. So thankfully, Anup has uh, baked that into the model. Correct. So now that you are also completed the course, you are legally certified through the D Life. So how have you been handling the clients now? And then do you see that the course fee that you paid? So how do you find that now, looking back, the knowledge that you gained and on the path that you are? How do you look at that?
The course is very worthful because it is not for the now only, it is for the whole life. I think we get the knowledge, we get the protocols. It can be used for the whole life, for the my family, for my patients. So it is very worth, I think so.
Good, good, good. And I know that you already have an ongoing medical practice. So, were there things that were sort of surprising to you, as well as are there elements that now you have added to your practice,
Yes.
after gaining that knowledge from DLife, so that you can give better results for your patients?
Yeah, I'm adding the protein diet meant to their diets. Previously, I used to avoid the protein diet
Mm.
mainly, but now I started to add the protein diet to that.
Good, good, good. Yeah, all the best. And I think, the joy of seeing a disease being reversed,
Yeah.
right? So I think that is something which is very unique about what we have chosen to do with D-Life. Because, I mean, sometimes I say that the real job of chronic disease healthcare is to reverse diseases in those who have it, and then to prevent diseases in the people, who are yet to get. So then teaching them prevention. I mean, that's the real job of chronic disease healthcare, correct? So we want to arm everybody, whether they are medical doctors or not, with that knowledge. And it's, as you correctly pointed out, human biology is not going to change, right? I mean, this is not some 3 month or 6 month course in how to drop your weight by 10 kilos. This goes way beyond that. It covers several aspects of metabolic health and teaches us disease reversal at the root cause. It's not like we are trying to sell products, some powder potion, things like that. But it's more about truly understanding and appreciating the biology, the resilience of our bodies, and our own inherent mechanisms of how our bodies can heal. Right. So I think it's amazing to see, a doctor like yourself to come complete the course and then start to apply. And I'm sure you're going to see amazing changes in your patients. Also, I know that,
also.
yeah, absolutely.
Yeah.
It's, it will rub off, that will definitely happen. Now coming to another point is that, so just like I remember talking to you, by the way, on the phone long back before you joined the course. So, if today a potentially, a prospective enrollee were to talk to you, what would you tell them about the D-Life diploma?
I would like to say, first of all, in our medical curriculum, there is no focus on the nutrition. They focus only on the disease and the treatment only. So I should advise or suggest to every doctor should do this course, because then only he can do the treatment. Otherwise, we can't get the satisfaction of that. We are just giving the medicines, only that much. There is no disease reversal. So for disease reversal, we should do this course and only D-Life course, because it is the ancient science related course. So it is not a fad diet.
Absolutely not. We use evolutionary biology as well, right? So sometimes people say that, hey, I want to follow a traditional way of eating. So then I tell them, and in all seriousness, that actually this is the real traditional way of eating, because we are relying on, the evolutionary biology and what it has shown us, the way we have evolved, the way our bodies have evolved in a environment of scarcity. And then now we live in an environment where there is this problem of plenty which is happening, right? And instead of only suppressing the symptoms, we are going beyond that. And as you said, getting the joy of reversing the disease. So in fact, I mean, if I may say about a doctor, right? Your joy will be in seeing a patient who doesn't need you anymore.
Yes.
Right? Because
That
otherwise,
is the happiness. That is the happiness.
Exactly. Absolutely. Good. Thanks for any last comments that you want to add about your experience overall. How have you changed things in yourself and your family? Any parting thoughts?
Yeah, I have started the D-Life protocol on my husband because he is obese and he had fatty liver grade 2. So now he's liking the diet. No, he want to take daily paneer and one time food or like chapati and bhaji. But so I said, please follow the purely protein diet. Don't eat the roti and bhat also. So, but he was saying that no, I will eat like this only because I'm liking this only. So then also he lose the 4 to 5 kg weight
Good.
in 2 months, and his fatty liver get reversed, and fatty liver grade 1 has come in 3 months.
Very nice.
So
Very nice. Congratulations. So
thank
see, this is your reversal story of a patient right at home, and not just trying to suppress the symptom or just manage the disease, but actually bring him from grade 2 to grade 1 and then to normalization fully.
So,
And that too, I must mention, on a vegetarian diet.
yeah,
Right?
and it is so difficult on vegetarian diet.
But still, yes, I mean, that's a very encouraging result, right? So if you go abroad, for example, as you know very well, they will essentially push people to do only keto, or only some other thing. And of course, I mean, keto can be done. It's nothing bad about it otherwise. But for Indians especially, and for many populations across the world, not everybody can do keto. So this is where the genius of Anup and D-Life lies. that they have made it really possible for people of different tastes and preferences. So you could be a vegetarian, you could be a vegetarian who eats eggs, and then you could be somebody who is sort of eating across dairy, eggs, and meat, everything, right? So for all of those protocols, it is possible to follow still the rules of biology, and the result is right in front of you. So
And without
congratulations on
exercise, without exercise.
yeah. I mean, of course, we
Yeah.
use exercise, but as chronic diseases
as
go,
of now.
right. So the main thing is going to be still fixing many of these lifestyle issues and not just solely focus on exercise. Excellent, well done. I must congratulate you and your husband as well. Good, well done. All right. So thank you so much. Thanks, Dr. Thakur, for giving this diploma review. And I hope people from different branches of medicine, as well as people who are not necessarily from medicine, they both take inspiration from your story, personal as well as your family story, and how you have shared your experience of doing the D-Life diploma. And I welcome everybody to check us out. This is something revolutionary that is happening in this space of metabolic health, not just in India, but globally. This is the biggest, grandest course in metabolic health and disease reversal. And I'm very proud to be a member of Team D-Life, as is Dr. Thakur. And we have 60 more doctors just like her from all branches of medicine, not just Ayurveda, all branches of medicine, and who are applying these lessons to their patients. And as she rightly said, reversing the disease, not just manage it. So yeah, thank you so much, Dr. Thakur, for this review, and goodbye, everyone. We'll meet again in another one. Thanks. Bye.
Thank you so much.